So on page 140, then they have the complications of an implanted port therapy. Again, with skin infection or skin breakdown, we've talked about extravasation. We talked about it a little bit when we talked about blood and blood products as well. Just a burning or sensation or swelling of the subcutaneous tissue. Again, nursing interventions for it is do not remove the needle, stop the infusion, and notify the practitioner, because depending on what the material was, what kind of fluid it was, whether the needle is going to be removed immediately or how it's going to be counteracted. And then thrombosis and a fibrin sheath formation. Okay. Let's see. Flushing, we've talked about with that saline, normal saline or heparin, depending on the protocol and whether the device is being used on a regular basis or intermittently. And then blood samples, the same thing. You withdraw, aspirate 10 cc's of blood from the line, and then to discard, and then you draw out your blood sample. So those protocols and those procedures are the same with any central venous access device. Now, on a side note, LPNs are not allowed via Board of Nursing standards in the state of Kentucky, and I'm almost positive not in the state of Tennessee either, to access any kind of central venous access device. You're not allowed to hang fluids, you're not allowed to do pushes, you're not allowed to do anything. You can do dressing changes on them, but you're not allowed to administer anything via a central venous access device. But you need to be aware of what the complications are and what the procedures are and what the patient teaching is, so that you can educate your patients and so that you can appropriately take care of them if they have one of these devices. So just because you can't go into that room and hang that bag of fluids doesn't mean that you should not be monitoring that site. Okay? And then if any of you have decided to go on and become an RN, or even further than that, you have some knowledge about what to do, and you're not completely lost when you get in there and you talk about central venous access devices. And this is on my soapbox here for a moment. You do not ever attempt to access a central venous access device knowing that you are not supposed to, okay? Okay, so in central venous therapy, remember that the access device is inserted with its tip in the superior or inferior vena cava. That the advantages include the ability to rapidly infuse fluids, draw blood specimens, and measure central venous pressure. Okay. The subclavian is the most common central venous insertion site. It provides easy access and a direct route to the superior vena cava and the central venous circulation. Nursing responsibilities include explaining the procedure and the care measures of therapy. Pediatric patients, for them the most appropriate is a Broviac, because it's the good for small veins. And then when drawing a specimen from a port, you're going to discard at least 5 mils. Like I said, I usually do 10, and it's based on the facility policy, but a minimum of 5. So if that is a question that I ask you, I will not give you both answers as an option, okay? So 5 at a minimum, 10 sometimes depending on the facility. So that is kind of a wrap-up of those things. And like I said, if you look at the reviews at the end of it, central venous therapy tells you the benefits, the drawbacks, the catheter types, things like that. It'll give you some of the good information. Remember that dressing changes are sterile procedures, and they do require a mask, gown, gloves, things of that nature. The patient should wear a mask if they can tolerate it. If not, they have to at least wear or turn their head away from the site while you're cleaning it. Okay. Central venous access devices, chlorhexidine is the scrub of choice. Most facilities now have kits that have everything you need in the kit, as far as the sterile gloves, the mask, and the chlorhexidine on there as well. If not, you'll have to put your own together. You can use iodine, betadine, but chlorhexidine is the drug of choice. And it is a scrubbing that is a back and forth and then an up and down motion. It used to be a circular motion, but now they recommend that you scrub back and forth and then up and down over the site to make sure that it is clean. So just remember those things.